Good morning, students. Today we'll talk about facial development in oral embryology part 1. Before we start speaking about facial development, some concepts have to be considered. When we say coronal section and sagittal section, what do we mean by them? Coronal section is a section from right to left according to a suture on the skull called the coronal suture, from right to left. Another suture at the skull is the sagittal suture, anterior posteriorly. So when you hear coronal section, it means from right to left according to the coronal suture on the skull. And when you hear sagittal section, it means an anterior posterior cut according to the sagittal suture on the skull. We will start talking about facial development from week 4 intrauterine life of the embryo. This is a 4-week embryo in the intrauterine life. At this period, we will start to see 5 lateral bulges around the developing pharynx. These bulges are called pharyngeal arches or pharyngeal arches. These lateral swellings or bulges, pharyngeal arches or pharyngeal arches, are surrounding in the center the developing pharynx. These arches are number 1, 2, 3, 4, and 6 in humans. Number 5 is missing in humans. We see it in lower vertebrates. So these are 5 on each side of the developing embryo. This process in the front is called the frontonasal process, and here you can see the heart. These pharyngeal arches or pharyngeal arches are composed of mesenchymal tissue surrounded by ectoderm and endoderm. Between each arch and the one next to it, laterally, we call it a groove or a cleft, and it separates the adjacent arches along ectodermal surface from the lateral side. Internally, we call it the space between each arch and the one next to it, we call it pouch from the center. It is an outpunching of endoderm from the foregut, and it penetrates the adjacent mesenchyme. Each arch contains cartilaginous component, muscular, blood component, and nerve component. If we take a coronal section in the embryo, we can see here the developing pharynx surrounded by the pharyngeal arch laterally, the 5 bulges that we talked about earlier. This is arch number 1, arch number 2, number 3, and so forth. Each arch is containing a cartilaginous component, a blood component, and a nerve component. The space between arch number 1 and number 2 from the ectodermal side or the lateral side, we call it cleft or groove, and between 1 and 2 from the endodermal part inside, we call it a pouch. Each arch has derivatives, and each cleft has derivatives, and each pouch has derivatives. The first arch is called the mandibular arch. The second arch, we call it the hyoid arch. The first arch cartilage is called Meckel's cartilage. The second arch cartilage is called Reichret's cartilage. This is another view for the embryo. You can see here the arches, and you can identify the clefts or the grooves from the lateral side or the ectodermal side, and from the inside you can identify the pouches here from the area of the developing pharynx. This is the developing pharynx, and in the front I have the frontonasal process. This is another diagram for the arches, arch number 1, 2, 3, 4, and 6. Here you can identify cleft number 1, cleft number 2, pouch number 1, pouch number 2. These arches will contribute to give the facial components. You can see here the embryo at age 4 weeks intrauterine. These are the pharyngeal arches, and here you can see the derivatives of these arches, or the final results of these arches. This is a table. We can see in this table the arches, each arch what it will give, and the table below the pouches what they will give, and the clefts what they will give. Here we said earlier that we have arch number 1, it is called the mandibular arch. Arch number 2 is called the hyoid arch. The muscle that will result from arch number 1 are the muscles of mastication, the anterior bulb of digastric, mylohyoid, tensor tympani, and tensor villi. The second arch will give us all the muscles of facial expression. Two arches may contribute to the formation of one muscle. For example, the anterior belly of the digastric muscle comes from the first arch, while the posterior belly comes from the second arch. The skeletal components, the maxilla and the mandible, comes from the first arch. Two of the ear ossicles, the incus and malus, comes from the first arch, while the third ossicle of the ear, which is the stabus, comes from the second arch. The first arch nerve, we call it the trigeminal nerve, and the second arch the facial, the maxillary artery as a blood component, and stapedial artery as for the second arch. You have to memorize all these components, and this table you have to memorize it. Below you here you can identify the pouches. For example, pouch number 1, it will give us the auditory tube, epithelium of the tympanic membrane, mastoid air cell, mucus of the inner layer of the tympanic membrane. The second pouch also will have derivatives. So you have to memorize these tables by heart. You will be asked about them in the theory exam. Here, what you can see in this image. On the left side, this is a plastic model for an embryo in age 4-week intrauterine life. You can identify the frontonasal process. This is the frontonasal process. At the 4th week of the intrauterine life, the first arch, the mandibular arch, will give us two processes. One we call it the maxillary process, and one we call it the mandibular process. These processes are coming from the first arch. The two maxillary and mandibular process on each side, together with the frontonasal process, these 5 processes will surround the developing mouth or primitive mouth, the stomodium. This is the primitive mouth or stomodium. It is surrounded by 5 processes. One is the frontonasal process, and number 2, maxillary process and mandibular process from each side. Here is a scanning electron microscope. You can identify A, the frontonasal process, C, the maxillary process, and B, the mandibular process from the first arch, the mandibular arch. This is the primitive mouth or the stomodium. If we take a sagittal section for that embryo, here you can see the frontonasal process. Here is the developing pharynx and gut, and here is the primitive mouth or stomodium. At age of 4 weeks, the primitive mouth or stomodium is separated from the developing pharynx by a bilaminar membrane. We call it the buccopharyngeal membrane or the oropharyngeal membrane. This membrane will rupture at the end of the 4th week, and there will be a communication between the oral cavity or developing oral cavity and the developing pharynx. This is a bilaminar membrane, ectoderm and endoderm from the inside, and this will rupture at the end of the 4th week. This is another diagram of the embryo. after the rupture of the bilamina membrane, the oropharyngeal membrane. This is the oropharyngeal membrane, the position is here, and you can identify and see that the first arch lies in front of this membrane. It lies in front of this membrane. These are the pharyngeal arches. Here you can see the pharyngeal arches and the developing mouth, which is surrounded by the 5 processes that we have said earlier. At week or the 5th week of the intrauterine life, what happens during this week? What are the structures you can identify? You can identify maxillary process, the mandibular process from the first arch. This is the second arch, the hyoid arch, and this is the first groove. Here, primitive mouth or the stomodium. At this stage of development, in the front of the frontonasal process, at the site of the future nose, there will be a thickening of the ectoderm. We call it olfactory placode or nasal placode, thickening of the ectoderm. Then this thickening of the ectoderm will sink deep inside the mesenchyme. That will give us a nasal pit. This is the nasal pit. It was at first as a placode, thickening of the ectoderm. Then it will sink deep. After it sinks deeply, the frontonasal process will perforate around this nasal pit, one from the medial side and one from the lateral side. The medial side of the frontonasal process, we call it the medial nasal process, and the one on the lateral side, we call it the lateral nasal process, surrounding the nasal pit. At this age also, we can see the position of the future eye. This we call it the optic placode. We see it at the age of 4 weeks intrauterine life. We call it the optic placode. This saddle area is called the nasal fin. This we call it the nasal fin. In front of each nasal pit, it is a sheet of epithelium in front of each nasal pit. If we take a section like this, what we will see, look at the next slide. This is the section that we have taken. Here I can identify the oral cavity. It is filled by the tongue. This is the developing tongue. This is B, the oral cavity. A here is the nasal cavity. The oral cavity is separated from the nasal cavity by a membrane. This membrane, we call it the oronasal membrane. By the end of the 5th week, this membrane will rupture, and there will be a communication between the oral cavity and the nasal cavity. This area, the saddle area, here E refers to what we call it the maxillary isthmus. The maxillary isthmus is a bridge of mesenchymal tissue that joins the mesial nasal process with the maxillary process. And this area is the nasal fin. As we said, it is an epithelial sheath in front of each nasal pit. Here a diagram drawing of the nasal fin. This C refers to the nasal fin, a sheet of epithelium in front of each nasal pit. E is the maxillary isthmus that we said earlier, it is a bridge of mesenchymal tissue that joins the mesial nasal process with the maxillary process. B here is the developing oral cavity, and D here is the oronasal membrane. By the end of the 5th week, this will rupture. This membrane will rupture, and then there will be a communication between the oral cavity and the nasal cavity. Here, as we said earlier, this is the medial nasal process. This is the medial nasal process, and here I have the maxillary process coming forward. This area in between, this is the nasal fin. This is an embryo at the age of 6 weeks. What happens at this point? Here, the nasal pit changed to nasal orifice. The frontonasal process surrounding this nasal orifice by medial nasal process and lateral nasal process. The medial nasal process will perforate below the nasal pit and moves backward to join the maxillary process, which moves forward. The angle of the mouth is established. The two mandibular processes from the right and the left will join in the middle to give us the lower jaw. The ear placode, we start to see the ear placode. The optic placode change into optic vesicle. We can identify two grooves, one between the oral cavity and the nose, we call it bucco-nasal groove, and the second groove between the nose and the eye, we call it naso-optic groove or furrow. Furrow or groove, the same meaning. The epithelium at the area of the nasolacrimal groove will, or the rhodoepithelium, will sink deep, and then it will canalicalize to give us the lacrimal duct between the eye and the nasal cavity for tears. It is between the maxillary process and the lateral nasal process. This is the scanning electron microscope. You can identify here. Here is the lateral nasal process. Here you can see the nasal orifice, and you can see the medial nasal process, and here I can identify the maxillary process. These are the stages what we have said earlier. At the age of 4 weeks, you can identify the frontonasal process, together with the maxillary and the mandibular process surrounds the primitive mouth or stomodium. Then the frontonasal process will proliferate more forward, starting to see the nasal placodes. Then it changes into nasal pit, and the nasal pit is surrounded by medial nasal process and lateral nasal process. The medial nasal process will join the maxillary process to form the upper lip, and the lateral nasal process joins the maxillary process to form the sides of the cheek. As you can see here, the mandibular process will form the whole mandibular jaw. The upper lip, the central part, which we call it the philtrum, is coming from the nasal, frontonasal process. It is not a pharyngeal R derivative, while the remaining parts of the upper lip comes from the first arch from the medial nasal process. The ala of the nose is from the lateral nasal process. This is a coronal section for an embryo at the age of 7 weeks, and here it is at the age of 8 weeks. At the age of 7 weeks, the maxillary process will grow toward the center of the developing pharynx. It will find in front of it the tongue, prevent the two segments from joining together. The maxillary process will grow downward. This downward growth, we call it the palatal shelves. At the age of 8 weeks, the head of the embryo will move backward. The tongue will drop downward. The two palatal shelves will be elevated once again to join each other at the age of 8 weeks intrauterine life. And they will be in full contact at the age of 9 weeks, and at between 9 weeks to 12 weeks, the two segments, the two palatal shelves, will form for us the upper palate, and at the same time, from the upper side, the nasal septum comes downward to join the two segments, the two palatal shelves. At this image, we can identify the tongue at the center of the mouth. It is highly elevated. This is the maxillary process from the right and from the left side. The downward growth here, A, refers to the palatal shelves, B to the tongue. You can identify at this image the Meckel's cartilage. It helps in formation of the bone. The cartilage will not be transmitted to bone. The bone is deposited lateral to Meckel's cartilage as intramembranous ossification. Lateral to Meckel's cartilage in intramembranous ossification. The cartilage or the Meckel's cartilage is a bar just for guide for the formation of the bone. It will not be transformed to bone. It is just a bar helping for formation of bone. Bone is deposited lateral to it. Between the cartilage and the bone, laterally, slightly above, you can see the neurovascular bundle for the lower jaw that will give us the inferior dental canal. This is an embryo. What can you see in this image? I can see the tongue. I can see the palatal shelves, the downward growth of the maxillary process. I can identify the Meckel's cartilage. I can identify the neurovascular bundle. What is the age of this embryo? Look at basic things. At first, we start to see bone in the lower jaw at the age of 7 weeks. With 7 weeks, we start to see the bone in the lower jaw. Here in this image, I can't see bone. Bone is deposited lateral to Meckel's cartilage in an intramembranous ossification. This is the lateral side of the Meckel's cartilage, no bone deposition, which means that I am not in the age of 7 weeks, because bone in the lower jaw we start to see bone at the age of 7 weeks. Also, another guide here, I can see the thickening of the ectoderm that will give us the primary epithelial band for the deciduous teeth. This is the primary epithelial band. We see it at the age of 6 weeks intrauterine life. Here, another view. You can identify the Meckel's cartilage. Lateral to it, no bone, meaning that I am before the age of 7 weeks. I can identify the neurovascular bundle. I can identify the primary epithelial band. You can see thickening of the ectoderm and the condensation of the mesenchyme under it. This we see it of the primary epithelial band at the age of 6 weeks intrauterine. Here I can see the two palatal shells are in contact in this midline area. This midline area of contact we call it the epithelial seam. At the age of 9 weeks intrauterine life, full contact between the two palatal shelves, and between 9 and 12 there will be a full union between the two segments. The epithelium will disintegrate and it will be removed to have the mesenchyme between the two segments as a one unit. And from above you can see the nasal septum. The Meckel's cartilage, you can identify it. You can identify the bone as two plates. Between them you can see the neurovascular bundle. This is the tooth germ. In this image I can identify the nasal septum, the nasal cavity, no two nostrils, the oral cavity. C is the epithelial seam, midline epithelial seam. A is the maxillary process, the palate, shells, and D is the bone, maxillary bone, palatal bone, and the maxillary bone of the maxilla. In this image I can see the epithelial seam. This is the epithelial seam between the two palatal shells. This epithelium will disintegrate. Here is the area of the epithelial seam, disintegration of the epithelium. Remnants of the epithelium at the midline area will give us cysts. This is the rests of epithelium, rests of the epithelial seam. The epithelial cells will grow, the central will be necrosed to give us cysts, which is a fluid-filled cavity. Here is an example of the epithelial remnants when they are activated in the midline. They are leading to the what we call it the midline palatine cyst. We have to remove this cyst surgically. During development, we have some spaces have to be larger or smaller, what we call it the remodeling process. So at the area of the space that we need to make it bigger, we can see osteoclastic activity more and osteoplastic activity on the opposing side. In this image you can identify embryo of age 7, of age 8, of age 9 weeks intrauterine life. At the age of 7 weeks you can see the palatal shelves, the downward growth. At the age of 8 weeks, the tongue will go downward, and the two palatal shelves will grow upward to join to each one with the other, and having contact at the age of 8 weeks intrauterine life. At the age of 9 weeks, full contact of the area of the epithelial seam together with the nasal septum, and full union between the two segments between the age of 9 to 12 weeks. Here from below you can see the palatal shelves moving one toward the other, and from above the nasal septum is coming downward. At the end they are joined together, forming for us the upper palate. Here at this area you can see the area of the philtrum and the primary. This is the primary palate. The primary palate which holds the anterior teeth, antral and lateral incisors, while the secondary palate which holds the canine and the remaining teeth. In this image you can see the maxillary process, the medial nasal process, and the lateral nasal process. The medial nasal process, the two parts medial from right and left, will give us the area of the philtrum. This is the philtrum of the upper lip, and behind it we have the premaxilla and the primary palate which holds the anterior teeth, the central and lateral incisors, and the origin of these is from the frontonasal process. They are not apharyngeal arch derivatives, while from canine backward, this is the secondary palate and it is a pharyngeal arch derivative. In this image here you can see the developing mouth, you can see the maxillary process and the medial nasal process. Here I can see the bucconasal groove, and I can see the naso-optic groove or furrow. The lateral nasal process will give us the lateral of the nose. Here, as we said earlier, the primary palate with the central and lateral incisors together with the nasal septum are from the frontonasal process, while the secondary palate from the canine backward is from the maxillary process, which is a pharyngeal arch derivative. The central and lateral incisors, the nasal septum, the philtrum are not pharyngeal arch derivatives. This is another view. You can see here the segments, the mandibular process from the right and the left side. They are contact at the center. Then the union between the two segments starts from the center towards the periphery. Then I have the segments as one unit. This is another diagram. We can see the sequence of dating. This is at the age of 7 weeks intrauterine life. I have the two palatal shelves. When the tongue moves downward, the two shelves will meet here at the area of the epithelial seam. This is the epithelial seam area. Between age 9 to 12 weeks, the two units, the two palatal shelves, the epithelium in the center will disintegrate, and the mesenchyme will be one unit between the two segments. This is a transverse section. I can identify Meckel's cartilage. C is the tongue. B is bone. Bone is formed lateral to Meckel's cartilage as intramembranous ossification. As the amount of bone deposited increase, the Meckel's cartilage becomes smaller and reduced in size till it disappears. The most posterior part of the Meckel's cartilage will give us the ear ossicles, incus, and malus. Meckel's cartilage doesn't meet at the midline area. Here it is D. We call it the midline symphysis. The cartilage of the first arch, as we said, it is the Meckel's cartilage. We start to see bone formation at the age of 7 weeks intrauterine life in the area of the mantle foramen, and bone will deposit it backward, forward, and upward, lateral to Meckel's cartilage. Between Meckel's cartilage and the bone, I can see the neurovascular bundle here. Bone will deposit around these neurovascular bundles to give us the inferior dental canal. Later on, between the age of 10 to 14 weeks into uterine life, 3 new ossification centers appears. One at the area of the midline symphysis, and the second is at the head of the condyle, and one in the coronoid processes. 3 ossification centers, and the bone formation in these areas is in an endochondral ossification. Here is the area of the midline symphysis. Here an ossification center appears between the ages of 10 to 14, and the area of the midline symphysis will complete formation after the child reaches the age of 1 year. Here I can see the cartilage in the midline symphysis. This is an embryo. Which age? Yes, it is at the age of 6 weeks. You can see the primary epithelial band, you can see the neurovascular bundle, you can see Meckel's cartilage. Meckel's cartilage containing chondrocytes in the center, cells, and chondroplasts on the periphery. Here you can see the primary epithelial band at the site of the future teeth. In this image, you can identify Meckel's cartilage and the chondrocytes and the chondroplasts, and here I can see the neurovascular bundle. Bone will be formed later to Meckel's cartilage, and the neurovascular bundle is between Meckel's cartilage and a bone slightly above. In this image, you can identify Meckel's cartilage, you can identify the position of bone, you can identify the neurovascular bundle. You can identify here is the tooth germ. Which stage? It is a cap stage. When we can see the cap stage, it is at the age of 11 and 12 weeks of the intrauterine life. This is the late cap stage. It is 12 weeks intrauterine life. You can see here Meckel's cartilage, chondrocytes, and the chondroplasts. Chondrocytes in the center, chondroplasts at the periphery, and you can identify the alveolar bone. By moving forward more, you can see the neurovascular bundle, bone formation as 2 plates around the neurovascular bundle, and here you can see the Meckel's cartilage, and this is the tooth germ. On the image on the right side, you can identify the Meckel's cartilage, the neurovascular bundle, and the tooth germ. Here I can see the tongue. This is more advanced stage. You can see the precision of the Meckel's cartilage. This is the bone. This is the neurovascular bundle. Here is the site of the tooth germ. This is more advanced stage. You can see here the Meckel's cartilage has disappeared. And here I can see the alveolar bone. I can see the inferior dental canal. And here I can see the tooth in the late pill stage. Here, why it is late pill stage? Because you can see here the deposition of the hard tissue. Late pill stage is the age of what? 18 weeks intrauterine life. Here you can see the bone, and here you can see the tooth germ. It is a late cap stage at the age of 12 weeks intrauterine life. You can see the dental papilla, and you can see the sac surrounding the enamel organ. Here you can see the enamel organ. Here you can see the enamel knot. This tooth is increasing in size, which means that there should be a remodeling process. So I have to see here osteoclastic activity to give space for the growing tooth. This is the tooth. Here I can see the inner enamel epithelium, stratum intermedium, B is the stellate reticulum, the outer enamel epithelium or external enamel epithelium, and here you can see the osteoclastic activity. Here is bone, and D is the osteoblast. Osteoclastic activity here to give space for this growing tooth germ. Here is the most posterior is the head of the condyle of the mandible. As we said earlier, at the age of between 10 to 14 weeks of age, 3 new ossification centers appears. One is at the head of the condyle, one is the coronoid process, and one in the midline symphysis. And these new ossification centers, the bone formation in them is as endochondral ossification. For development of the tongue at the early age of the embryo life, the head is folded forward. Later on, at the age of 8 and 9 weeks intrauterine, the head will move backward and the tongue will drop downward, so that will be the oral cavity and nasal cavity are separated. The tongue is formed by 2 lateral swellings from the first arch and the midline tuberculum impar. These will give us the anterior 2/3 of the tongue, and the posterior 1/3 of the tongue comes from the capula. Between the anterior 2/3 and the posterior 1/3, I can see the sulcus terminalis, the V-shaped sulcus. The nerves that contributes the first for the tongue are the mainly is the second pharyngeal the second nerve, and with the contribution of the first, third, and fourth pharyngeal arches. These contributes to the innervation of the tongue. So the tongue, the anterior 2/3, is formed by 2 lateral lingual swellings from the first pharyngeal arch, with the midline tuberculum impar, and the posterior 1/3 from the capula from the third arch. What are the anomalies that are related to the face and nose? Anomalies meaning that the segments during facial development fail to meet together, giving us what we call it facial clefts. The facial clefts are failure of embryonic facial prominences to fuse together properly. Depending on which prominence or segment fails to meet, they will give us different facial clefts. For example, cleft lip, cleft palate, cleft lip and palate. At the region of the nasolacrimal duct or groove or facial clefts. Here you can see different types of clefts. You can go back to your textbook and see and read about these clefts. For example, median cleft lip at the area of the median. The 2 medial nasal processes fail to meet together. Unilateral or a bilateral cleft lip, the failure of union between the medial nasal process and the maxillary process. These are an oblique facial cleft between the bucconasal and the naso-optic grooves or furrows. Also, you can here identify the cleft lip, cleft jaw, and the cleft palate. Here, different types of clefts. Here you can see the median cleft lip, 2 medial nasal processes at the center. Median cleft lip for the lower jaw, the 2 mandibular processes fail to unite together. Here the maxillary process with the medial and the lateral nasal processes. Macrostomia, big mouth, microstomia, small mouth, bifid nose, and incomplete median cleft upper lip here at the area of the medial nasal process fail to unite together. You can see this is from the frontonasal process. In this image you can see the different types of clefts. You can see on the left side, this is the area of the primary palate, here is the secondary palate. These are the palatal shelves. The failure of union between the medial and lateral nasal process, the cleft in the lip only, or the lip and the palate, or the lip, the primary palate and the secondary palate, unilateral or bilateral. Here is the cleft in the secondary palate only. Thank you for following me in this lecture. See you next week. Good luck.